Hi everyone and welcome back to the Hair Loss Show. And this will be our last session in our series of Q&A. So stick around, we'll go through the last set of questions.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Right, so once again, thanks for submitting all your questions to the community post. We were over inundated with questions. There were some really good ones there, but we haven't been able to go through all of them, obviously. But thank you very much for posting those questions. If you've liked this format, if you like this Q&A sort of series that we've been doing, we can always come back and do more. So please let us know. And please remember to like and to subscribe to the channel. Right, so last set. So this is a question is, how will HRT, testosterone, affect my finasteride dosage? Will I need to increase from 0.5 to 1 milligram daily to a larger dose? So this is an interesting topic, and I could probably go on for a long period of time. I actually did a study on this last year on a group of men that were on testosterone replacement therapy that were also experiencing male pattern hair loss. And what we did find was that there was a significant increase in the number of people that required either a higher dose of finasteride or the addition of a second or a third agent, be it minoxidil and or dutasteride therapy. So we know that there's probably a correlation there, because if you add more testosterone in the system, potentially there's an increased conversion to DHT, and in that group of individuals that are predisposed to be sensitive to DHT, their levels are higher, and therefore they may experience more hair loss. But it's not, I don't want to be prescriptive about it, in the sense that if you're on any form of testosterone replacement therapy, then you definitely need a higher dose, because really it depends on what your A, starting level of testosterone is, and B, what your endpoint with use of testosterone. If it's still within physiological normal range, then you may be fine. But it is important to have this discussion with your prescribing physician. So make sure that they know that you are on testosterone replacement therapy and they understand the implications of that, and then monitor how things go, because you may not need a higher dose. But in scenarios where you are progressing and you are losing more hair, then the dose may need to be adjusted, and or additional agents may need to be added to your repertoire. But that's a great question, and I hope that gives you a little bit more clarity. Right, so next question is, are diffuse thinners a good candidate for a hair transplant, especially in the younger population? I think if someone is in a younger population and is losing hair, then generally they're not a great candidate for a hair transplant, because we don't know how they're going to progress. You can maybe make the generalization that a younger person that's experiencing hair loss automatically gets put into a more aggressive form of androgenic alopecia, and you want to be in that group a bit more conservative on how you would approach the surgical option, certainly early on in their lives. So you want to make sure that they're stabilized with medication and that they actually are stable before considering a surgical option. And that probably is even more compounded in someone who's got a diffuse pattern. You want to be very careful, because transplanting in those patients, you may not get a great outcome, because the donor hair has the propensity of miniaturizing in the future. So again, this is something that you need to speak to your doctor about. Make sure you take good advice for someone who's trained at managing these conditions, and then will be able to advise you appropriately on your journey, because this will be a journey for you. It's a long process, and you want to make sure that you're stabilized. And if you are considering a surgical option, make sure it's done at the appropriate time, with a view on the future and potentially mitigating any further loss going forward. All right, so hopefully that answers your question. And the last question from AFG is, can I combine saw palmetto with and finasteride? So we've talked about this, we've talked about saw palmetto in one of our previous videos. We've talked a lot about finasteride. What they both are trying to achieve is to block that 5-alpha reductase enzyme and therefore lower that level of DHT in the system. And if you've got androgenic alopecia, you've got a sensitivity to that high level of DHT. I guess the short answer is yes, you can combine saw palmetto with finasteride. That's fine. I'd probably say it's probably not worth it, because if you're taking finasteride, the additive effect of taking the saw palmetto is probably negligible. So, you know, it's about optimizing. I'm a big believer in just taking the least amount or the lowest dose of the least amount of medication. So why take 2 tablets when you can take 1? It's just probably about optimizing your dose of the finasteride, as opposed to adding a second agent such as saw palmetto, which is essentially or ostensibly doing the same thing. All right, so just stick with the 1 would be my advice. All right, so thank you very much. That probably brings us to the end of this set of Q&A. My apologies to everyone that put forward a question that we haven't been able to get through. Again, if you like this format, let us know, and we can do some more of this in the future. Thanks again for watching. Please remember to like and to subscribe to the channel, and we'll see you again on the next episode. Take care.